How's it going, guys? We have a past level question for Endocrine. 32-year-old woman. She has a 3-day history of feeling very hot, sensation of palpitations, moderate tenderness beneath the hyoid bone palpation, temperature 99 Fahrenheit, heart rate 95. What's most likely seen in this patient? So we're telling you that she has hyperthyroidism here. Heat intolerance, okay, you can get palpitations, and the thyroid gland is located beneath the hyoid bone in the neck. And you got some tenderness here, okay? So what are we going to see in this patient? Choice A, antimicrosomal antibodies, also known as antithyroperoxidase antibodies, is wrong. This is Hashimoto thyroiditis. In addition, you can see antithyroglobulin antibodies. This, of course, is hypothyroidism, not hyperthyroidism. You'd have increased TSH, decreased T3, T4. So you'd have cold intolerance, not heat intolerance. You get bradycardia, not tachycardia. It's not associated with a tender thyroid virtually always. Maybe 1 out of 15 questions I've seen mild tenderness, but you don't want to read between the lines on it. Also, students will ask about transient hyperthyroid state and Hashimoto. It's also getting nitpicky, pedantic, and it'll get you questions wrong on USMLE. Wrong fucking answer. Choice B, antithyrotropin receptor antibodies, is wrong. So thyrotropin, this is important to you guys. This is another way of writing thyroid stimulating hormone. You're like, wow, I didn't know that. Okay, well, USMLE wants you to know it. So the mechanism for Graves is you've got antibodies against the TSH receptor, okay? They're called antithyrotropin antibodies, okay? So you could say thyrotropin receptor antibodies here. And these antibodies are called thyroid stimulating immunoglobulin, TSI. Graves' disease, you're gonna have increased T3, T4, decreased TSH, but it's not associated with a tender thyroid. That's why this is wrong. Wrong fucking answer. Choice C, decreased iodine uptake. Correct answer. This patient has dequervain thyroiditis, aka subacute thyroiditis, aka subacute granulomatous thyroiditis. It's the answer on USMLE. When you have a tender/painful thyroid, they will only mention viral infection preceding the dequervain in about 50% of vignettes. If we want to make this even more past level, we'd say she recently recovered from an upper respiratory tract viral infection, now has a tender/painful thyroid. I mean, you're talking like you would fail by 40 points internal scoring if you didn't know that, okay, for dequervain. Some of you are like, fuck, I didn't know that. Well, better know that, now you do, right? So the thing about the dequervain thyroiditis is that you have decreased iodine uptake in the thyroid gland, even if you're hyperthyroid. And the reason, it can be hypo, or hyperthyroid for dequervain thyroiditis, but you have decreased uptake because you're not synthesizing new thyroid hormone. You're merely releasing preformed hormone into the blood because you have inflammation of the thyroid gland and you have increased spacing between the thyroid follicular cells. Okay, they want you to know that as well. They can give you the same question here, ask you for the mechanism, and the answer can be something like release of preformed thyroid hormone. It's not hard, okay? So you have decreased uptake in the thyroid gland, even if you're hyperthyroid. And that differentiates it from Graves, where you have diffusely increased uptake because you're making new thyroid hormone in Graves' disease. Toxic multinodular goiter, which is condition elderly, where you have multifocal uptake. Toxic adenoma, which is a singular adenoma, you'd have a single focal area of uptake. Increased uptake in those scenarios of hyperthyroidism. But in dequervain, you have decreased uptake. I've harped on this. Let's just whip to the final ones here. Jod-Basedow phenomenon is not going to show up on USMLE, but this is somebody who has a pre-existing thyroid disorder such as Graves' disease, who's exposed to an excessive amount of iodine, and they get hyperthyroidism as a result. This is in contrast to Wolff-Chaikoff effect, which is where someone with a healthy thyroid gland, normal person, is exposed to increased/excessive amounts of iodine, and they get a transient shutting off/inhibition of the thyroid gland. So you can think of these as both escape mechanisms, where it's a natural negative feedback to shut off thyroid hormone production as a safety mechanism. If you have exposure to increased amounts of thyroid hormone, that's Wolff-Chaikoff effect in healthy patients. But in people who have thyroid disorders such as Graves, they lack this ability to have the safety mechanism in place, and they'll get increased thyroid hormone as a result. Wrong fucking answer.